And just thanks to, oh yeah, thanks. Thanks to everyone. We are, you can see who's all here of the county commissioners. Commissioner McDonough will be joining us shortly, but we have all the other commissioners here, and the staff will be introduced as they are speaking. I want to first of all thank the Health and Wellness Service team, St. Paul Ramsey County Public Health and Property Management, all of whom are presenting at today's workshop, and for their continued dedication and work on leading the 555 Cedar transition. It embeds a residents first approach that we've all been supporting and working toward, and that aligns with mission, vision, and values of Ramsey County. As the chair of the workshop and on behalf of my colleagues, the Ramsey County Board, we appreciate this opportunity to take a deeper dive into the planning and the next steps of this transition. We know that the future home and site of these important public health services and programs and the staff that work at 555 Cedar and who serve our community will continue to grow and flourish well beyond the 65 years that we have been at this location. For today's presentation, I'd like to ask that questions be held until the end so that we can get through the presentation. So write down your questions, and then after that, we'll be ready for a full discussion afterwards. So with that, I'd like to turn it over to our Health and Wellness Service Team Deputy County Manager, Kathy Hedin. Thank you so much.
Thank you, Chair McGuire, and good morning to the rest of the commissioners and to the team here today. If we could go to the next slide, please. I'm here with Public Health and Property Management to introduce this workshop. Director Hawley, Interim Deputy Director Diane Holmgren, Division Director Gina Pistolka, Medical Director Lynn Ogawa, and Property Management Director Jean Kruger. We'll talk about a future with a new way to think about health services and without a 555 Cedar building as the clinical health center for St. Paul Ramsey County Public Health. As Chair McGuire stated, this building has been the center of health for Ramsey County for 65 years. That's a long time. These services have changed over the years based on the community need and on what services are available in other community health or large health systems. But many people have come through these doors over at 555 Cedar. Some of you may remember the robust refugee health program that worked to welcome Hmong community to St. Paul multiple times. Other of you may have used the old travel clinic that was available to make sure you had what you needed to travel abroad. Today, the team will focus on what it means to leave the site and how we plan to take a racial equity and residents first approach to the future of a possible community health hub that could include a partnership that would have support from the entire health and wellness service team. What will be presented today sends us on a trajectory to continue to address the health needs of our community, understanding that health can be very broad. Before we move on, and especially because we're talking about a building that we've cared for and services we've provided for many years at 555 Cedar, it's important that we do acknowledge the land that we are on. So next slide, please. Thank you. Every community owes its existence and vitality to generations from around the world who contributed to their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, and some were drawn to leave their distant homes in hope of a better life, and some have lived on this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We are standing or on the ancestral lands of the Dakota people. We want to acknowledge the Ojibwe, the Ho-Chunk, and the other nations of people who also called this place home. We pay respects to their elders, past and present. Please take a moment to consider the treaties made by the tribal nations that entitle non-Native people to live and work on traditional Native lands. Consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. With that, I will turn it over to Director Sarah Hawley.
Thank you, Madam Chair, Commissioners, County Manager O'Connor, Deputy County Manager Hadeen, staff, community. Thank you for joining us here today. It's an honor and privilege to be before you to present this important information. Our objectives for today are to share information on the current services and communities served at 555 Cedar, to review the relocation of existing 555 Cedar programs and services to a new location, to also review existing engagement and future opportunities for engagement, both internally and externally, to review key considerations for this transition and areas of exploration, and to discuss next steps and the timeline for this transition. So as previously stated, Public Health has occupied the Public Health Center, Don Juneman Building at 555 Cedar in downtown St. Paul, and on Dakota land, providing public health services to many Ramsey County and Twin Cities residents over the last 65 years. The move for public health out of this building is not a new discussion. However, our goal today is to provide updates on the transition of existing public health services, programs, and staff from this site to other sites in Ramsey County. You may ask, why are we moving out of a building that carries so much history with staff and community and has been a public health landmark in downtown St. Paul for so many years? Well, with 65 years of time spent at this site, we have outgrown it, and our clients and expectations and needs have changed. It has aged, as all facilities do over time. We have also learned through past and current internal and external community engagement that the specialized services we offer at this site should be more embedded in community. And lastly, this particular site could be put to better use as times and the needs of our communities has changed. Down a little bit. All right. With that said, our goal is to transition out of this site by December 31st. Next, I'd like to briefly highlight the clinical services and public health programs we currently offer at 555 Cedar.
Director Hawley.
Yes.
I'm sorry to interrupt you. You said January 31st. Sorry.
Oh, I'm sorry.
I saw you look all over. Can you clarify the year just to make sure we're all like, this is the first time we've done a date, and I want to make sure we are just crystal clear on your date.
Yes. So the date, the corrected date, thank you, County Manager O'Connor, Chair McGuire, our transition date out of this building will be December 31st, 2023. And so that's our goal, to transition out of this site is in a couple of years. Thank you, County Manager O'Connor. Next, I'd like to cover the clinical services and public health programs that currently occupy 555 Cedar. We have a total of 50 part-time and full-time employees in clinical services that provide a wide array of services: sexual health services, refugee health programming, sexual offense services, also known as SOS, immunization services, perinatal, hepatitis B prevention programming. We do our outreach and syringe exchange services at this site, and also our tuberculosis control services. I want to note that not all services under clinical services are clinical based, as you can see on the screen. And these are the programs and services that will need to be moved to the new site. Next, I'd like to transition to talk about our administration division. We have 46 part-time and full-time employees working in our administration division. That will include planning, focuses on housing stability and other social assurance services. We have financing and accounting in this division, along with public health labs and our employees. To Dr. Lynn Ogawa.
We see a number of individuals who have had difficult experiences in regular Most of our patients also have other needs, such as housing stability, food access, clothing, and we're seeing a rise in mental health needs as well. Many of them have experienced language barriers and transportation problems with regular healthcare as well. Next slide, please. So this is some basic data on the most recent client visits at 555. So this includes the clinical services, as Director Holly mentioned, Clinic 555, which is sexual health and family planning, tuberculosis, and immunization. So this is from a total of 3,447 clients and about 11,000 or 12,000 visits. Overall, 51% identify as male. When we look at the gender, which is interesting, as a primary care provider, usually we see actually that women make up more of the visits, and so this is a little bit different than most clinical sites. We do recognize that when we look at race, when we look at all of our races combined, still 68% of our population are from racial and ethnically diverse communities. I just also wanted to highlight here that when we look at our racial breakdown, and I don't have the numbers in front of you, but I wanted to highlight them. For Clinic 555, our largest percentage of individuals served by race are Black, and that's at 43%. Our second most common race is white for 555. Now in immunizations, it's more of an even split with Black being 33% and Asian being 29%. However, in tuberculosis, over 50% of our clients are Asian and an additional 31% are Black. And so the majority of our patients in TB are other races. Our syringe services, which we opened just a few years ago, have been amazing in the individuals that they have served. Over 2,700 individuals served with 3,000 exchanges in 2021. Next slide, please. And when we look at the ages served, they are quite a spectrum. Again, in our immunization clinic, we tend to see an even spreading out of the ages 0 to 12, 13 to 17, and then older than that. In Clinic 555, we clearly see population between the ages of 25 to 45, most in need of those sexual services and family planning. And then we see primarily an older population within the TB clinic. Many of our cases of TB are what we call reactivation TB, and so that tends to affect individuals who are older. We, however, unfortunately do see a small number of individuals who are quite young as well. And so this is a bit of a breakdown of who walks through our doors for clinical services within 555. I will pass now to the next person.
Thank you, Dr. Agawa, Madam Chair McGuire, commissioners. This slide reflects the following range of services and options we are planning at our new site. As you can see, we plan to have our outreach and syringe exchange, our coordination of refugee health, sexual health, which is the Clinic 555, partial accounting services and administration that support the programming at Cedar, our medical records, central registration, immunization services, TB services, the public health lab, perinatal hepatitis B prevention, and house calls. We are also planning to allow for other public health programs outside of these two divisions to drop in as part of improving client access to other public health services, and as mentioned, to possibly other health and wellness service team programs. And I'm going to pass this on to Interim Director Holmgren.
Good morning, everyone. Nice to see you this morning. Thanks for joining us. I would just like to mention the programs that would be transitioning out of Cedar and to move to Plato and not go along necessarily to another location. And as you can see, calling out first, the red box on the slide there is our vital records operation. That's been at Cedar all these years with a few movements in between, but we're under discussions with IPR in terms of moving that to the service center or to the service team and the Plato location for vital records. And the other services that would move out of Cedar that are more administrative in nature include our accounting and contract management services, other administrative support, information services, the one side of our billing operation that deals with the entry. We would retain a financial counselor to take payments and to help clients with their payment setups that would travel with the clinics wherever they would be located. And then we have an employee health and safety operation and maintenance. The SOS program is currently located at Cedar, as Sarah mentioned as well earlier, and we're envisioning moving that to Plato's to be closer aligned with Healthy Communities Division in Public Health and other violence prevention activities as well. Next slide, Sarah. Thank you. So we continuously work to align things that we do with the plans that guide our work, such as our strategic plan and our community health improvement plan priorities. The public health strategic a strong perspective for clinical services through immunizations, our work in STIs, syringe services, and preventing the spread of tuberculosis as well. Back up, Sarah. In terms of the community health improvement plan, just to also highlight a couple notes on that too, that we keep this in our vision as well, that we want to help address access to health services. And when we think about access, we're thinking about the right care, the right level, the right time, the right place. And it's so much more than being insured or underinsured. It's really about access and proximity. Next slide. So Sarah mentioned residents first approach, as did Kathy, I think, and so that's clearly a direction we want to go as we look to move forward. Some early information we had focused on those areas that you see there for residents first facing facility north of downtown, University Avenue area, east side, Payne Phelan, in community where people are. So we're continuing to assess our location information. We're looking at zip code information currently to identify where our current clients are coming from, where they've been coming from in the last couple of years, and try to look at what the spread is. We know people come from all over, but we need to utilize that information to inform our work too. We've also received some community engagement funds so that we can work with community more closely to identify what's important to the clients that we serve in terms of physical location, space design, co-location with other services as well. Ideally, we would also be able to obtain some input from people that are not using services due to a barrier and identify what we could do to decrease that barrier that is occurring for them to access services as well. So that'll be underway too. Next slide. 15. And I'm gonna turn back over to Gina.
Thanks, Diane. With gaining feedback from the community and getting input in mind, we've been looking at the different surveys that have taken place and that we've conducted, as well as the Ramsey County Accessible Service Delivery and Facilities Survey. This survey was conducted in 2018 as part of a community engagement work during Ramsey County strategic planning. And that was done to better understand how accessible our services were and how to improve the service delivery and align with the residents' first approach. These responses below list the highlighted responses from the 105 interviewed specifically at Cedar. And you can see that 86% used a personal vehicle to reach the location, 23% traveled 11 plus miles to reach the facility, 89% visited the site 2 or fewer times in the last 3 months that the survey was conducted, and 25% reported parking as difficult. Those surveyed also recommended the co-location of services such as healthcare, insurance, food, housing, and social services. Next slide. More recently, we conducted a survey on site in November through December 2021. We reached approximately 1,200 people in vital records, syringe exchange, clinical 555, TB, and immunizations. And as you can see, for all of the services, car travel was predominant, followed by walking at 16%. Next slide. This slide takes a closer look at the responses for those who access clinical services only, those being the services that are planned to transition to another site. And as Diane mentioned, the vital records will be going to Plato. The pie chart in the middle is the total for all clinical services, and each service is called out on the sidelines. Again, the car travel is primarily the mode of transportation for our clients, particularly in Clinic 555, immunizations, and TB. Something of note though, in syringe exchange, we do have some different survey results. Those who walked or biked were 35% of those surveyed in that area. And light rail as a total was 7%. The other interesting finding here was that taxi and ride sharing accounted for higher percentages in Clinic 555, immunization, and TB. This could be as part of their healthcare plan, friends or relatives car sharing, or just general taxi or ride sharing. And I'll turn this back over to Diane.
Sorry. So we know that one of the critical factors for us is engaging with people as we prepare to make this move and do all the planning associated with it. Communication with staff particularly was up front and center for us. We had an all-staff Zoom meeting in December and invited all the staff at Cedar to participate. And what we heard, is probably not a complete surprise. And what you see here, change is hard, kind of was the biggest thing. For many of our staff who've been in the building a long time, they're used to coming here. They know that clients recognize this building and it's a familiar place to go. So that's also a hard change for people. They want to be sure that people will be able to find us wherever we go. So that really speaks to the need for planful communication as we make a shift as well too. We do intend to keep regular communication with our staff so that they get frequent updates and are involved in the planning, and especially when we get to some of the design work of the space as well too. People did identify a concern about moving away from light rail, and you saw from what Gina had just mentioned that about 7% of our clients travel by light rail, and there's quite a variety. Parking is also an important factor for clients and for staff that was raised as well too. Staff also mentioned having other resources nearby or co-located with would be useful for the clients and for referrals that they're trying to make as well too. Next slide. In addition to conversations with staff, in December, we also had conversations with our public health leadership team and the health and wellness executive team also. What we heard from those conversations is briefly summarized here. Again, ensuring the new location honors what's important in a residents first model. The opportunities for co-location, people are very interested in possibly co-locating some level of service in this hub facility as well too, with both Ramsey County partners as well as community partners. And it was recommended to take a look at the residents of current clients as we try to identify where people currently live and where our best location might be. And we're in the midst of looking at that right now, assessing the zip code data that we've already collected from clients that we're currently serving. The other keynote was that in this transition from 555 Cedar, it really expands the opportunity for public health to grow capacity to provide services in the community, and that it's important to make sure that there's room for growth and partnership growth as well as we move on. We don't want to move into a space that's just the right fit at the time and not allow for us to expand or shift in the future as well. All right, and with that, I will turn it over to Sarah.
Thank you, Diane and Gina, for the presentation, that important information. Now I'd like to shift, Madam Chair, commissioners, to talking about some of our key considerations for future space needs. We have approximately 96 staff that are currently working at 555 Cedar, with 30,000 square feet currently being used for all clinical services and administration staff. This includes our laboratory, our X-ray room, our exam rooms, vaccine grade refrigerators, freezers, our generator, right, our registration and lobby areas. We have a number of staff workstations. And then we also have a receiving area for medical and office supplies and vaccines and other medical related items. And then we also have a large storage space to keep all of these important supplies at that building. Shifting to thinking about some other key considerations as we transition out of this space is that we have approximately 28 staff, as mentioned before, that are currently at 555 Cedar that will be moving to 90 Plato Boulevard by December 31st, 2023. And with this transition, we'll need to determine space needs and redesign options to accommodate staff and program needs at the Plato site. So considering existing and additional staff, so thinking about additional staff workstations, those shared workstations, storage, private conference space of various sizes. And I think this directly aligns with our move to our flexible workplace policy. So we'll keep all of that in mind as we transition staff out of Cedar to the Plato building. Some other key considerations for future resource needs. With any big move like this, we'll need to consider our resources for this relocation. This could include funding to purchase and/or lease and renovate a new facility for the 555 clinical services and admin staff that are not moving to 90 Plato, possibly utilizing funds from the sale of the property and/or existing county funds to support the move and to sustain the new site, and an annual operating budget for this new facility. Right, before we move on, I want to highlight a few other key considerations that will continue to be a part of this transition and the engagement that we do, not only with community, but with staff here at Ramsey County. We want to ensure that we keep a residents first approach at the center of our decision-making, including leading with race and health equity. We want to continue to explore the benefit of co-locating public health services that are not currently at 555 Cedar. We want to identify a site or hub that is embedded in community. I think that's been lifted up many times here this morning. The possibility of expanded options for on-site hybrid space that aligns with our flexible workplace policy. We want opportunities, as mentioned before, for expanded community partnerships and resources to support the residents of Ramsey County. We want to explore the role of the community navigator in this new location. We want to identify a location and space that fits our needs and the needs of our community. And lastly, we want a site that allows for a future expansion of services and partnerships within this new site. All right, as mentioned earlier by Deputy County Manager Hadeen, based on what we've presented here today and what we've learned so far from community and staff, we have an opportunity here to expand our reach into community with this transition through the specialized public health services and programs that we've offered at 555 Cedar for over 65 years. In order to build on our residents first approach, we'll continue to explore the potential benefits of a community hub concept. This concept of a community hub is rooted in the following definitions. A community hub is a public space that brings several community agencies and neighborhood groups together to offer a range of activities, programs, and services. In addition, a community hub connects residents most impacted by inequities to public health, social services, and human services to improve their health outcomes. This community hub concept is not aiming to replicate our service center model, but to transition and potentially expand public health services and programs that are offered at this new site. Based on the definitions of the community hub, we plan to further explore the concept of a Ramsey County Health and Wellness Service Team community hub. This hub would include the relocation of existing 555 Cedar clinical programs and services to a new location, with the exception of some administration staff. It would open up the opportunity to add public health services and human service programs, including behavioral health services and other environmental health services, health protection programs, and services at this new site. It could leverage the county's community navigator model and expand our work and partnerships with other community agencies and resources that our community could benefit from on what we know so far through our engagement. This community hub concept would build upon identifying a location and community based on existing residents first facility engagement and additional engagement by public health in 2022 that recognizes the significant impact that COVID has had on the needs of our communities most impacted, and how this community hub concept could work to transform how we deliver public health services into the future. Next, Director Kruger and I will walk through our proposed timeline and next steps. I'll start off by highlighting the Public Health Department's next steps. In quarter one, in 2021, we've continued that initial planning discussion, both with our team and with property management, and as the team has mentioned earlier, with many key stakeholders here at Ramsey County. We continue those discussions with our staff, with our public health leadership team, health and wellness exec team, and other Ramsey County leadership on this transition. In quarter one of this year through quarter two, we continue to gather data on engagement that has been done in the past and what we aim to do in the future from community and staff engagement. Sorry about that. All right. And we plan to have further consideration of the fit with other public health and health and wellness service team programs, potentially other departments here at Ramsey County as a part of that engagement and further information gathering. I want to note that quarter three and quarter four of 2022, public health will be reviewing the information that we collect, not only from internal key stakeholders, but from our community partners to help inform our work, not only with public health, but with our partners in property management. All right, next I'd like to turn it over to Director Jean Kruger.
Good morning, Commissioners. Thank you for that, Director Holly. Before I talk about this next steps, I just want to take a minute to do a little look back There's frequently the questions regarding the strategic facility plan and where we are in relation to that. And many of you will recall that the strategic facility plan did identify the 555 Cedar facility as one that might be best to vacate. We've had a couple starts and stops in evaluating that and in really making a firm and I think final decision on that. But that is now, as you're hearing, the direction we're putting forward. Along the way, the last few years, the work that has been done under the accessible services and facilities, as well as the residents first facilities, we've continued to maintain this path whereby the public health clinical services that you've heard about really do justify a standalone facility, as opposed to being incorporated into some major service center that we are otherwise also planning related to being a replacement facility for that service center functionality that's currently, downtown based at the East Building. So just wanted to share that this is all in concert and collaboration and part of that bigger picture in terms of how we deliver services for residents, both from the clinical side as well as on the service center for the other functionalities. With that, as you heard, we're working closely with public health, and in Q1 and Q2, the main efforts that we need to complete is really to finalize what we would refer to as the SPACE program, just defining from the programs that you've seen identified to go to Plato or to go to a new facility, just how much space does that translate into. With that information, then we will kick off in earnest a site search that would accommodate that space requirement, as well as meet the geographic needs that public health will be identifying through their additional data gathering that they are working on. By the end of Q2, we would expect to be back before the board after working further with public health and finance to identify funding and seek approval for funding for both the facility, the building, which at this point we're assuming may be an existing building that we would look to purchase or to lease. We would also be looking to secure the funding that would be necessary to do the build out, construction, likely furnishings, IS tools, etc., to really secure the approval to move forward with this as a project. Beginning in Q3 of this year, we would then do the solicitations around what we would expect to be a design build process. Once that solicitation is complete, we would expect a couple-month design period, again, working closely with our selected contractor and public health, and then move into that build-out construction, which we do expect, optimistically to be a 6 to 9 month window to do that in order to allow a relocation to occur, as you've heard, in Q4 or by the end of 2023. Although this timeline speaks specifically to the public health and new facility, excuse me, I'd be remiss if I didn't also state that there will be activities going on related to the, well, then what about 555 Cedar and that redevelopment of not only our own CED, but also we know that the St. Paul Planning and Economic Development would have a role, would have an interest in the site for redevelopment. But I just want to also point out for those that don't recall that this 555 Cedar location is actually within the Capital Area Architecture Board planning area. And we would be really working hand in hand with them as well for redevelopment on this site. So just wanted to point out that that too has to happen, and we would be doing that in parallel with the work related to the new public health site. And with that, I will turn it back over to Director Holly. Thank you.
Thank you, Director Kruger. I will shift it over back to Chair McGuire as we will stand for questions and discussion. Thank you.
Excellent. Excellent to all of you. I might just remark that that was an amazing presentation by a lot of different people. It was very seamless, and I knew by the timeline that you gave me that you all were amazingly prepared and just moved through all those slides very well. So thank you for that. Great presentation. So with that, now I will entertain our discussion, and I have some hands raised, and so I'll call on Commissioner McDonough.
Thanks, Madam Chair. A couple of words came to mind when I looked at the presentation and prep for the workshop, and then listened to all the presenters here today. And it's thank you, thank you, thank you. And not to be cynical or critical, but finally, we've been talking about this a long time. And Jean, you know, connecting this back to some of the early work, especially with the strategic facilities work, the residents first work, and all that was really helpful, but it was obvious how connected this is to that work in the presentation from all the folks here today. You know, I'm an optimist, and in some ways I think that, you know, and like I said, this has been talked about a long time, not just, you know, at the strategic facilities, but sometimes the motivation or agenda to push us to potentially get out of there wasn't necessarily a residents first approach, because we weren't even using residents first. We weren't even acknowledging it. It wasn't about a collaborative, comprehensive, how do we integrate in the community about delivering services, because we weren't even talking that language. And so in some ways, the timing for this is amazing because of all the work we've done on our mission, the vision, the goals, the values here, and the strategies, and being able for all of you folks, Sarah and your team, the leadership team, to really incorporate those values, and then reaching out to the community and listening. So this is really cool. Weddings in the community. So I got some great memories. Just congratulate everybody and the good work you've done. To find that, it actually drives a stronger connection and the slide
much, Commissioner.
That the last couple of years with COVID and so forth has really gave us a better focus on how to move on this. Pieces have always been there, but we never had a clear vision of the direction. And I think over the last couple of years, the expertise of the staff with the community input and dealing with COVID in terms of a health issue really has focused our vision. The question I have, because it'll help me wrap my head better as you look for space for me to evaluate, is
Madam Chair, Commissioner Ortega, I'll yield to Division Director Pastolka or Dr. Ogawa to talk about our reach into the Hispanic community.
Thank you. If one of you would like to take that, that would be great.
Thank you, Chair McGuire, Commissioner Ortega. We do see a small population of our Hispanic or Latino communities. Just looking here at our percentages. One moment. We see roughly 14% in all of our programming. So that would be anyone who's attended our Clinic 555 services, TB program, or our immunization program. And I can get you breakdowns after this meeting if you'd like more details.
I would appreciate that. So that's 14%. And what was it for the African American and the Asian population?
Chair, Commissioner Ortega, I'm sorry, within the TB program?
Yeah. I'm
Yeah.
just focusing in on the TV. It seems to me that that's an issue we got to deal with.
So within the TB program, it's approximately 54%. It's not unusual for a TB program, actually. We have, for those of you who remember the multi-drug resistant TB outbreak, unfortunately within the Hmong community previously, that highlighted and shifted our work to
I'm raising the issue because, I mean, when we're dealing with infectious diseases like this, once COVID is over, these TB is part of the grouping of infectious diseases that are impacting our communities of color more than anything else that we might do. So that's why I raised the question. I think it'd be important that as we pick the site that we have, I mean, you already pointed it all out. I'm not going to repeat it. But the transit and so forth are going to be critical to this because I know when I worked at Cruz, I got COVID, and so did about 20, TB, and so did about 20 of my staff. So it does impact not just the people that are, but the people they come in contact with and who they work with, especially in the community. And it could be crippling. So, thank you. Those are my only comments.
Thank you, Commissioner Ortega. Commissioner Reinhardt.
Thank you, Madam Chair. I would differ just slightly. That. But I think we probably all have had experiences there. And I think staff did an absolutely fabulous job of bringing this forward. This transition is going to really focus in on the residents first. That is so important to us. And so Jim said it so well. Thank you.
Thank you. Thank you, Commissioner Reinhardt. I now have Commissioner Carter.
Thank you. Having a hard time there. I really appreciate the update here on the direction in which this planning for 555 Cedar is moving. And I will share, along with other commissioners, all of us, I'm sure, but kudos to staff for the concentrated planning around our vision and mission and goals and objectives for community, and specifically focusing on residents first, but also with this focus of working with design partnerships in a co-located fashion for services that make sense and can work together to meet the needs of our community and also to meet the needs of our staff. I appreciate Commissioner McDonough's story about the manner in which they have accommodated in these facilities for so long, the kinds of arrangements that are needed to do a really good job for community, but now working together with community, organizational partners in particular, as we look forward to doing in the future, and working with the voice of community, in particular those most impacted on what this design ought to look like and how the configuration better serves community. I just look forward to the work that we will be able to do. I wanted to mention too, that again, this is in the context of our overall facilities plan. And this is a microcosm, perhaps an early example of the work that we look forward to doing as we think about all of our facilities and forward-facing services and how in fact we can do a better job of connecting them to people in their lives. As we think about that, I am just wanting to also reinforce the design, not just for the services, but also for the people, including the children and spaces that are accommodating and friendly, of course, and spaces that are little for children will be important in this process. But also designing spaces for community to gather. The footprint will make a difference, how large the space is and how much we can spread out in it. But if we can be mindful in working together with community about making a welcoming space also a belonging place, and think about, as we think about conference rooms, how can we work together with our community to open that up so that it is not only shared, but it is owned together with our partners that we're working with organizationally, and also with our community, in particular those most impacted by these services, who should feel welcomed, who should feel belonged, who should feel as though they belong, but also who should feel a sense of ownership in this location. So thank time frame isn't long here. And I think we all joy in that. There is a plan for moving forward within a 2-year period of time. And so that's going to go very quickly. And I wanted to make sure those comments were made ahead of time. Thank you so much.
Thank you so much, Commissioner.
Put on record that I very much support a better and higher use of 555 Cedar for our community, and what that looks like, as well as moving the public health services into communities. For a relocation. I don't remember that coming up in this year's budget proposal. Will we?
Continued change of our organization. This may at some point, and Jean, you may want to add, and this is one of those things where ultimately, as we get further along in the planning, we may come back with an ask. We may need to reprioritize. We may need to figure out where this fits. Some of these opportunities find us at the moments when they find us. And so that's going to be a part of the ongoing piece with the board. And it looks like Deputy County Manager Hadeen found some money while I was talking.
For COVID. Look like. And so
Actually, I have a couple of questions too, just because it is exciting, and I so appreciate all of your vision and saying, well, maybe we shouldn't put money into a building that we're going to be transitioning out of. And so just thanks for all those good questions and realizations. I think I know this, but just to affirm, we talk about, being in community and having a hub, and so we're sort of open in our facilities plan to have maybe several community locations, and maybe one hub, or has that been determined yet? But it's not maybe just one, but there may be several spaces that we're looking at. And then I have another question related to transit. It surprised me that only 7% were using transit. When I'm assuming, I mean, when I'm thinking, we actually want at least the hub to be on a transit line. So just curious on if you want to comment on a couple of those things.
Madam Chair, Commissioners, I'll comment on both. I think, from a community hub standpoint, I think this is where the ongoing community engagement, not only internally, but with community, the folks that are impacted, the folks that have been accessing services at 555 Cedar for so many years is going to play a role in identifying whether or not it's a site or a sites. As I mentioned before, our clinical services are at the forefront of this transition and making sure that we have a space that is appropriate. I think Commissioner McDonough mentioned earlier the importance, or maybe Commissioner Ortega, the importance of having and continuing those confidential services, right? Those medical services that are very specific and specialized services that we do offer through clinical. We do have a home, right? To keep that in mind. And I think not only our staff, but our community
Thank you, Madam Chair. I just wanted to add to that one piece, which is, although certainly desirable to have public health services out in the community and as many places those specific clinical services are very likely to be at one hub as opposed to many. But as you've heard, there are numerous public health services that perhaps more easily lend themselves to being offered at more locations. So that's just my little 2 cents there as we were talking about the cost just a couple minutes ago. And the other I would add, certainly it is a it will be a challenge to ensure we are, readily available to the most of the community that needs the services. Thank you.
Thank you so much, Director Kruger, for all of those really important points that you're making. Thank you. County Manager O'Connor.
Thanks, Madam Chair. I just want to build on Director Kruger's comments at the end. Any data we take currently on mode share to our site is a building that was built before any of our current high frequency transit network existed. And I think what you're seeing from the Green Line's performance in this setting actually is pretty good. I would even say when I look at those maps of how people get to our sites, what we see is more people than across St. Paul's regular mode share taking transit, biking, and walking to reach this site. And while the overall numbers remain smaller than long-term what they will be, I do think that's an important takeaway, particularly as we think about our climate goals and the conversations we've had with the board. I think in both this conversation and the downtown service center conversations, we're building for the next 1, 2, 3 decades in terms of our thought process and moving out of a model that's been with us for a very long time.
Thank you, County Manager O'Connor. That's well said. Division Director Postelka, and then Commissioner McDonough.
Thank you, Chair McGuire. I just wanted to add to the conversation about other sites. We already have satellite or mobile sites that we hold in other places in our sexual health and our syringe exchange program. And we do plan to continue that so that, you know, we will be going into the community regardless of where that fixed site is.
Thank you. Thank you for that. I appreciate that. Thank you. Commissioner McDonough.
Yep. Thanks, Gina, to remind us that we will still making sure, because I did want to give a kind of a counter to Jean's point. You know, I looked at those numbers pretty closely, like the walkers, the highest number of walkers were for needle exchanges. Well, you know, that's where our highest number of homeless are concentrated. It's just blocks from there, right? So it's where people live is sometimes as much or even more important than accessibility. We say the bus is connected. The Green Line's one thing because that's, you know, stationary. But we got to remember, we've got moms with 2 or 3 kids that might be taking 3 buses to get there because we've got this hub and spoke model for our transit system. So I don't want to lose the sight of the fact, and one of your slides talked about, you know, very specific, north of University, you know, the east side, you know, north or west of Dale or something, you know, being where people live is important too, because even though that transit piece is important, and I'm a strong believer, and it gets us connected, we don't have necessarily all that well of a connected transit system in our community. And yep, they show up off the bus, they show up on your graph as using transit. It doesn't tell you how many transfers they took with the 3 kids in the stroller to get to that building, how long it took them to get to that building, and how long it's going to take them to get back home again. So making, you know, ensuring that we're really taking a look at where people live, and the accessibility piece that goes a little bit deeper than just the mode piece, I think is going to be important.
Thank you. Thank you, Jim. Again, well said. I am looking around to see if there's any other questions or comments. I am so grateful. Oh, Director Holmgren, thank you. Give you a chance to make a comment, please. Yes.
Thank you, Madam Chair. I just wanted to comment that it's amazing to hear the support, you know, for the work we're doing. I've been around through many years of conversations about this building and many stalemates in terms of improving the building because we weren't sure what we're going to do with it, to the benefit, you know, of all of you and past commissioners. Since, you know, the building was transferred to Ramsey County, there's been a big investment. And so, you know, we've done the best with what we've got, which is great, but it's time to look at a new shift. And I'm so thrilled to hear your encouragement for what we've laid out and the work that we're doing. Circling back to the comment, you know, that I raised up about staff saying change is hard. It is hard, but when we look at also all the change our staff have been through the last 2 years, they can weather change and they will come through it perfectly on the other side, no doubt about it. And some of our staff are very excited about this opportunity too, to create something new and different, new space for them to serve our clients and our residents well in. So it's a great opportunity to move forward with at this time. So thank you.
Thank you so much. I really appreciate those remarks. Commissioner Reinhardt, and then Modis Castillo. Okay, Commissioner Reinhardt.
And I think Commissioner Modis Castillo said no, actually, that she didn't have comments.
Okay.
I think, you know, all of the comments that have been made have been right on. I do want to point out that there are needs outside of the city of St. Paul for Ramsey County. And, you know, granted, there's a more concentration in St. Paul, but the services are, if you think it's hard to get to 555 Cedar from someplace on the east side, just try to get there from White Bear Lake or Arden Hills. I mean, it's impossible because there isn't a transit option. But I do know that our staff have done a great job in trying to make sure that we have facilities or options available, even if they're not year round. And some of them are. And so I wanted to at least to speak up for that, the services that are currently coming out of 555 Cedar and that transition, that we do serve the entirety of Ramsey County. Thank you.
Thank you. Thank you so much, Commissioner Reinhardt. Director Holly.
Thank you, Madam Chair. Thank you, commissioners, community, 555 Cedar staff that are watching and listening, County Manager O'Connor and Deputy County Manager Hadeen and Director Kruger. I truly, just on behalf of my department, I truly appreciate the support in this journey and jumping into the process and being able to lift up this important transition. You know, I think about this as a blank canvas that we can build together. Not only with staff that have been working at 555 Cedar, but our community. And so I think this is an incredible opportunity for transformation and to build on the mission, vision, and values of Ramsey County. And so we will continue to work towards that December 31st, 2023 due date. And I truly look forward to identifying a site or sites in community that are truly providing services that our community needs and wants and probably has been requesting for some time. And so I just want to lift that up here in this space. And I just truly appreciate the support that has been given here today. And we look forward to coming back here and providing updates and moving this project forward. Thank you so much.
Absolutely. Absolutely, Director Holly. Thank you. Those are great closing remarks. I was going to say as well, thanks to all of my colleagues and all of you on this call, the presenters that did such an amazing job. This is a conversation that will be continued. I see that Commissioner Reinhardt has another comment, and that's fine. And then I will open it up to any of the presenters who want to make any final remarks either. First of all, Commissioner Reinhardt.
Thank you. Sorry, those were great ending comments, but a thought came into my mind, and that is that I know that the school districts in the suburban area have expressed an interest in co-locating some of the services. I know White Bear Lake actually looked at an opportunity a few years ago as far as really doing a co-location in a facility, and you know, all of the work that they're doing here. But that is one opportunity, especially when you're talking about services to kids. I mean, it's a great opportunity, and if there are school districts where we could, for certain services anyhow, provide that in the community, I just didn't want that to get lost. Now I'm done. Thank you.
Absolutely. Thank you. Thank you, Commissioner Reinhardt. Those are good points. Thank you for those. So with that, I'm going to ask if thanks again to Division Director Postelka and Holmgren and Director Kruger and Director Holly, Dr. Ogawa, and Deputy County Manager Hadeen. If you would like to, I maybe will open it up for any final remarks from Deputy County Manager Hadeen or any of the others. But just thanks for a great presentation, and we look forward to further conversations on this important topic.
Yes, Chair McGuire, thank you so much. Thanks for being the chair of this workshop. The team did a great job. There's a lot of work to come, and there's a lot of questions that people will continue to have, and there's a lot of creativity that can happen based on connection with community. One group that you didn't see here today is our WIC division. They used to actually be in 555 Cedar, and we actually moved them out a couple of years ago before COVID. But they are an example of how you get creative in community. Not only do they have satellite sites, but they're also embarking on mobile units. And so this is the type of creativity and innovation we want to look for in what's to come with the future of our clinic work and our health hub. So looking forward to bringing back additional exciting news and progress. And thanks to Director Collins, who's also here. As you know, Director Kruger brought her up. There's a role for her here and her team moving forward. And she's been a part of these conversations since we started them back last summer. So appreciate your support here today too. So thank you all, appreciate you.
Thank you for recognizing Director Collins as well that I missed. Okay, well, thanks to everyone, really appreciate it. And just have a great rest of the day. We have another workshop at 1:30. So that will obviously be on another link, but thanks again for all your work and for a great presentation. Take care, everyone. Meeting is adjourned.
Good workshop.
Thanks.